Go ahead and put the soft tissue in the back here. Again, this is going through the lamina and the hoof wall. This is going to bear weight. As the horse lands, the impact of energy, okay, and the concussion as he lands is going to be dissipated through your soft tissue. Frog, digital cushion, lateral cartilages, okay? The two need to work together. If you lose one or you lose the other, the game's out, okay? So let's look at the lateral cartilages, or your side bones, your ungual cartilages is the proper word. They play a role in lateral expansion of the hoof capsule. Every time he lands, the hoof moves outwards, equalizing pressure within the hoof, and it, again, decreases concussion. All these things, when we put the whole thing together, it's an amazing piece of work, okay? And here they are. They're two rhomboid sheets, okay? They're half in the hoof capsule, they're half on the outside. You can feel them up above the coronary band. And with Dr. Balgersworth recently, they've shown that they've had some projections here on the inside. So if you have a good heel in your horse with nice bars, when that horse bears weight, these are going to contact the bar structure in his heels, and this is going to help with the expansion of your foot. Okay? Again, from the beginning, what I want to show you here is, if we here's our blue line, the center of rotation. And this is showing you the back of the hoof capsule. And if we look at the hoof capsule, and we look at the structures within, we'll see that 2/3 of the hoof capsule is taken up with bone. 1/3 of the hoof capsule is taken up with soft tissue. That has to be that way, or the horse wouldn't be able to relieve concussion or bear weight, because the hoof capsule has to be able to expand. But here's the problem that comes in, and here's where farriery comes in. Both of these structures, all these structures, need to be contained within the hoof capsule. Okay? So if these heels are growing forward or whatever, when we start to leave this part of it out, we're looking for trouble. Digital cushion is composed of long fibrous trabeculi or strands, elastic fibers, fat cells, okay? This forms the back of your foot. You ever look at the bulbs of the heels? This is what forms the back of the foot here, okay? And it shapes the palmar section of the foot and the back of it. It plays a major role in absorbing concussion or dissipating energy during landing, but it's not meant to bear weight. And this is what happens when you lose your heels, or your heels grow forward, and you start to put your weight-bearing structures on here. And as this gets smaller, you can see my thumb and my finger here. When you go ahead and you put in this little commissure here in the frog, and you go up above the bulb, in the bulbs of the heels there, the closer you can bring your finger and thumb together means that you're losing that structure in the back there. The more and it doesn't come back. The more you lose that structure, the more you have, or you lose the ability to dissipate energy. Okay? We're going to put joint capsules in our foundation. This is going to allow these bones to glide smoothly against each other. It's going to preserve cartilage. It's going to go ahead and secrete fluid. It's going to make that a very movable structure. We're going to add ligaments. As you see, we have very little muscle. We have very little soft tissue from the fetlock down. So these are going to go ahead and stabilize or keep your joints in position, and it's going to also go ahead and guide your movement as the horse goes forward and backwards. Okay? And then we're going to finish up with tendons, which is going to allow your horse to pull his limb forward, to flex it, and then come back and extend it. And the deep digital flexor tendon is another structure that plays a big role in the conformation of the horse's foot. And a lot of it we really don't understand, but what I wanted to show you here is to think about the tendon. Look at how it sort of fans out when it goes into the hoof capsule, because this actually forms your support structure behind the navicular bone. In other words, in the back of your foot. Okay? This is a real, real important structure. Shortening of this unit, we're looking at something like a club foot. Lengthening this unit, we're ending up with some kind of very low heel. The blood supply, with the exception of internal organs, no part of the body is as vascular as the horse's foot. Remember, especially the front foot is right underneath the heart. And if anybody's cut into the sole, or saw a farrier or a veterinarian cut into the sole looking for something or whatever without a tourniquet, you got a bloodbath in your barn. if you can remember, okay? And the main sources here, we have the palmar digital artery, the circumflex artery, and the coronary artery. And very briefly, here would be your digital artery. Here's where your blood comes into the foot. This is your circumflex artery, okay, on the perimeter of the coffin bone, feeding half of your lamina. And then your coronary artery is going to feed the other half of the lamina. Remember, for the structures of the foot, especially the sole growth and whatever, the blood supply, again, is affected by farriery. Okay? Long toe, low heel, anything that puts excess pressure on there is going to impede the flow of blood to those soft tissues, or those coriums that we talked about that's going to produce your sole and tissues of the foot. Okay? This is kind of unique, and these are called plexuses, and this is how blood is taken out of the foot. But they serve two purposes, okay? And one is obviously to move blood out of the foot after it's done its function and it's deoxygenated. The second thing is they form plexuses. This is another one of your anti-concussive mechanisms, okay? And you'll see these plexuses across here. There's one at the coronary band, there's one underneath the sole, and there's one beside the lateral cartilages. Okay? So when the horse goes ahead and he puts weight on the ground or lands on the ground during exercise, these plexuses here are actually dissipating some of that energy when he lands. Okay? And if we look at the back of the horse's foot, you'll see here we have a plexus around the coronary band. We have one on either side of the lateral cartilage of your side bones. And then if we have a nice thick sole, we have a nice plexus underneath the sole, because when the horse lands, his foot actually descends in the hoof capsule. His sole flattens, so you're using that plexus there as well. Okay? Now we're going to go ahead. Remember I told you about the porous nature of the coffin distal phalanx here. Okay? This is the periosteum, and periosteum covers any bone. Okay? Not only does it supply nutrients to the bone, it forms lattice work, it forms a framework to attach something. Okay? And if you don't think this is an intimate attachment here, take a foot apart and try and remove this soft tissue from the bone. I mean, it's just intimately adhered. Okay? So now we have something, a framework here, and we want to attach a hoof capsule. Okay? And we're going to go ahead and put a hoof capsule over this. Okay? And you'll see right away, see the tubules in here? Okay? We'll get into that just a little bit in just a minute. Okay? Now, to hold the hoof capsule in place and to take the weight bearing from the ground through the hoof onto the bone, we need to have an interface. And as you all know, the interface is the lamina. Okay? This is a micrograph of the lamina. Just to orientate you, here's your blood vessels, or your circulation, your subcutaneous tissue here. Here's your primary lamina, secondary lamina. Here's your hoof wall here. These are all hoof tubules. You'll see the different shapes, okay, through there. But what I wanted to bring out here, and then this is another reason or to fight against these long toes or these hoof capsule distortions, is because if you look at the secondary lamina here, see it? Look at the horn hoof tubules being produced by the secondary lamina. Okay? See them all the way down here? This is one of the problems that happen to us in laminitis. If we disrupt this horn production here, we're taking away one of the production of new hoof wall, and we have to rely completely on the coronary band. Okay? And what happens with a long toe is that you get this lamina tearing, or you get a little bit of low-grade lamina demon here, and you stop this production of hoof wall there. One of the reasons I wanted to put that slide up there. And I think by the time we'll finish, we'll make all this come together. And there's the lamina system. And if you doubt that the lamina supports the weight of the horse, just think about laminitis. And all the horses that we lose to laminitis. If you were to take the lamina out, spread it out across here, it would equal 8 square feet. Pretty amazing. Okay, and here's our lamina attachment. We're going to attach this. Remember our periosteum, or our lattice work there? Here's our lamina, and we're going to attach it with the hoof wall, or we're going to attach our hoof wall to the bone via the lamina. And the lamina attachment, it attaches the hoof capsule to the bone. Okay? It supports the weight of the horse. In other words, when the weight comes down, the weight goes through the lamina up onto the bone, or down the bone through the lamina onto the ground. Okay? It's the way the horse supports weight or bears weight. It allows the hoof wall to grow distally. Think about it, it's just like Velcro that just keeps going downwards. Okay? And again, it's anti-concussive because it's a giving structure. When this horse goes to bear weight, there's an interface there that allows this horse to sink down. Okay? Sole, plexuses, all these things are coming together. Sole corium, I think. There we go. Okay? You'll see here, this is the corium here, and this is the papillae on the bottom of your corium. And this papillae goes ahead and secretes your horn of your sole. And again, if you're putting abnormal pressure on there, different torque, hoof capsule distortions, you're going to impede the growth of the sole there. Okay? This is what it looks like if you cut half of it away. And what I wanted to bring up here is that you're going to, everywhere you go, you hear about frog support. You got to put a frog support pad in there. You got to put a hard bar shoe on. You got to, Number one, the frog was not meant to bear weight. It can assume some of the weight-bearing function, but it's not a weight-bearing structure. Okay? So if you look at this line here, you'll see here's your horny frog. Okay? Here is your corium. There's your deep flexor tendon. And there, again, is the corium. So when the horse bears weight, the frog goes ahead and it deforms. And it deforms laterally. In other words, it just smooths out. So all the hoofs, all the structures you want to put on there really don't have that much value. Okay? You just want to keep this structure in a healthy manner, which I'll show you in a minute.